Today I want to talk to you guys about spinal fusion surgery. I want to give you guys my opinion on what it is, why I tell most of my patients to avoid it at all costs, and to exhaust all other forms of treatment prior to seeking out this form of healthcare. The only time that I personally recommend this for my patients to seek this type of treatment if everything else has failed to work, including acupuncture, massage therapy, chiropractic, decompression, physical therapy, any of those conservative treatments, as well as other invasive procedures. I always recommend those prior to this, if at all possible, including microdiscectomies and laminectomies. If those continue to be non-responsive, then this should be considered as a last option, not a first option or a second option for non-specific low back pain that's persistent over several months. So let's take a look, and I want to show you why this is my opinion as to recommend this absolutely last if necessary, okay? Question is this: do I have patients who have had lower back surgery and fusion surgeries, and whether it's the neck or the lower back, and have had success? Yes, I have. Have I seen patients that have had failed back surgery? Yes, I have. And what I see more in my clinic than not is the patients that have experienced an equal or negative response to the surgery. And I'm going to show you guys some stuff here, some statistics here, and all of this is peer-reviewed research. This is medical opinion. This is not blog. This is not a single doctor's opinion. This is medical literature, and this will all be cited in the video description. So FBSS is failed back surgery syndrome. It's a generalized term that's often used to describe the condition of patients who have not had a successful result with back surgery or spine surgery and have experienced continued pain. Let's keep going. There's an ICD code, so there's a diagnosis code for this procedure. Mechanical complication of internal fixation device of a vertebra. What does this mean? There's a complication resulting from fusion of the vertebra. There's an ICD code for it. Continuing on. Increased complexity of back surgery increases the rate of failed back surgery syndrome. Failure rates range from 30 to 46% for lumbar fusion. So at the high end, it's almost a 50-50 shot as to whether or not this is gonna fail, okay? And it's not just like it's failing like you snipped out a part of a disc or a laminectomy. You're failing with surgical hardware fusing around your vertebra, which is very difficult to reverse, okay? And 19 to 25% for microdiscectomy. This is why I recommend this procedure first. Most patients I see that have had a microdiscectomy are very happy with the outcome. Again, some more statistics on surgeries here. 29.2% of patients had the same or increased pain. We're talking worse off than prior to the surgery 12 months after surgical laminectomy. A laminectomy is where they're going to remove a piece in the back of the vertebra where it's become arthritic. It is way less invasive than surgical fusion with screws in place. And I'll show you guys an example of an x-ray here in a second. So I would think that the more invasive surgical procedure with a longer time of operation and recovery would have a higher likelihood here. But again, these are the only statistics that I found specific to this right here. And a 35% success rate in terms of perceived recovery, functional disability, and pain 15 months after fusion for treatment of back surgery. What does this mean? You've already had a failed back surgery. You go in for a fusion after the failed back surgery. So this is your second surgery. There's only a 35% success rate. That's about 1 in 3 odds if the first one didn't work at all. I don't want that type of odds on my spine, if I can help it at all, okay? And I would think most of our patients have the same type of thought process. I just want to show you guys the statistics. Back surgery often results in biomechanical changes within that region, resulting on an increased load burden within adjacent structures. This can accelerate degenerative changes, aka arthritis happens faster within the areas in the spine of both above and below the fusion. Meaning if these two joints are fused, the segment above and the segment below is likely to experience advanced arthritic changes due to the lack of motion here. The joints below it, the joints above it have to take on excess motion. That means excess wear and tear over time. Fusion of the lumbar spine to the sacrum, so where they fuse your spine to the tailbone down at the bottom, as well as fusion of multiple segments may lead to sacroiliac joint disease. Also down here, altered biomechanics from back surgery may result in increased tension of the prevertebral and postvertebral muscles. Prevertebral muscles, postvertebral muscles, basically saying muscles around the spine directly controlling movement of the spinal column. Increased tension on these muscles can lead to stiffness, inflammation, spasms, fatigue, which all may act to elicit pain in the paraspinal or areas around the spine. Basically saying around the area of surgery. The muscles can cause pain themselves. In a study by Fritz et al. In 2001, comparing surgical with non-surgical treatment for low back pain, 18% of the patients in the fusion group developed early, within 2 weeks. I mean, this is really early onset complications, and 6% had late complications. So 24%, almost 25%, guys, okay? Complications included bleeding, neural injury, heart failure, major gastrointestinal bleeding, pulmonary edema, aspiration sepsis, pulmonary embolism, dural tears, hematomas, pseudoarthrosis, meaning the joints didn't really fuse how they were intended, and even wrong level surgery, meaning they fused the wrong segments, right? These aren't minor complications, these are major complications. We're not talking about itching or redness on the skin. We're talking about heart failure. We're talking about gastrointestinal bleeding, pulmonary edema, embolisms, wrong level surgery. This is major stuff. And we're looking at about 25% according to this study here. Nevertheless, complications associated with spinal fusion are not uncommon and can be life-threatening. Despite a lack of superiority of spinal fusion over non-operative treatment of patients with chronic non-specific low back pain, basically what that says is there's no superiority of spinal fusion over non-surgical treatment. There has been a steep rise in the rates of spinal fusion over the last 2 decades. Spinal fusion is also associated with morbidity, disease, and mortality, death. Spinal fusion is associated with death. Okay? The statistics are low, but there is there's a percentage you could die from the procedure, okay? This begs the question as to why there is such a trend. Why is there such a trend here? If there is no superiority, if there's no evidence that it's better than one procedure over the other, or non-invasive procedures, okay? And the other thing here is patients with failed back surgery syndrome may also experience complications from attempted treatment of their pain, right? So this stuff's not working, they're trying to figure out how to take it. So they're taking over-the-counter anti-inflammatories like NSAIDs. So prolonged NSAID use like Tylenol, Aleve, acetaminophen, ibuprofen, stuff like that has severe adverse effects on the gastrointestinal and renal health, your kidneys. Opioids also have significant addictive potential. You guys all know that. One study found that opioid overdose was the most common cause of death following lumbar fusion surgery. That's not the way I want to go out, is overdosing on opioids because I had a back surgery that didn't work. I know that's not the way you guys want to go out either. Not saying that there aren't instances where back surgery does work, because there are. I have a lot of patients who have had back surgeries, fusions that do work great. I just want to show you guys and introduce you to some of the statistics, because I know a lot of people that have tried physical therapy for 2 to 4 weeks for their back pain. It doesn't work. They rush them right into surgery. I just want to let you guys know there are other options with less risk of long-term consequence here, okay? I want to show you guys some examples of some x-rays here of patients that have come into my clinic after back surgery. We're not talking before, we're talking after the surgery has been completed, and I've got them here, okay? So the first one I have is for an older patient who went in to get L4 and L5 fused together. He was having radiating pain. He went in to get these segments fused. He was still persisting in severe pain a year after the treatment, and he had to get a second fusion surgery done. I have 3 issues with this second surgery. The first one is pretty obvious. The first surgery didn't work. It didn't resolve his pain. Okay? The second issue that I have here, so these are actually 2 separate surgeries. The first one, L4 and L5 are fused. The second one is L2 and L3. So the second issue that I have is a posterior translation after fusion. So the back of these vertebrae should line up real smooth. The back of the vertebrae right here are smooth. The back here are not. There's a posterior translation here. That is like this on the model. If we have a posterior translation, do you see what that does to that nerve right there? It can pinch that nerve, compress, reduce the space that nerve has to exit. That can cause pain. The third issue that I see right here is it looks like the surgical screws here may be or are very close to protruding through the top of L2 into the disc space between L1 and L2. Either way, it's causing pain and inflammation, which will lead to degenerative changes down the road due to the screw. That's, if it's not bulging through, it's very close to bulging through. I have a frontal image of the same patient here. So instead of from the side, we're looking from the front. Imagine this patient standing in front of an x-ray mirror. We can see the two separate fusions here, okay? But what we're looking at is the top of this screw and L2 right here, okay? So it may be bulging through the top of the vertebra and impinging on the L1, L2 disc space right here, leading to further inflammation and degeneration down the road. And the last x-ray I have, again, this is another patient that presented in my clinic after spinal fusion had failed. I want to show you guys, here's the low back from the side. We can see it had fusion done between L5 and his sacrum. That's the triangle tailbone that you sit on here. The back of the vertebra, normally including the sacrum, should be a nice smooth line here. And we can see there's a big posterior translation at L5 and S1. I mean, I'm talking a pretty significant posterior translation. And unfortunately for this young man, there was not much I could do to help his condition. Again, because of his fuse, I can't do anything here. So I'm just trying to let you guys know my opinion. Again, this is just my opinion, and is why I recommend this as a last option for back pain. And to avoid it at all means necessary if possible. But again, this is just my opinion. If you guys have any questions, comments, please post them down below. I'll be sure to answer any questions you guys ask. And I want to thank you guys so much for watching. And stay tuned. I'll see you guys in the next video. Thank you.